Next, coming to food allergy in children, sir. So
Okay.
you have been working in this area for quite some time now, I must say, and you've done some great work, including all the research and including your practice around the same. So, would you
Thank you.
start by telling us, what are the common symptoms of food allergy and how to know if your child has food allergy?
Good question. Common symptoms of food allergy, um, and this is also answers the question how to know if your child has food allergy. Um, it the most common symptoms and pretty easily discernible are urticaria, that's itching, skin rash, and angioedema, that's swelling in the or like hives in the skin, and that angioedema can also occur in your respiratory tract and can be pretty dangerous. Um, Anaphylaxis is another symptom, and that's even more dangerous, and that's life-threatening. Fortunately, that's not common. That's pretty rare. But if your child has any of those three phenomenon, they should go to a physician and be tested and treated, and you should get an EpiPen for that child. Um, Oral pruritus or itchiness of the mouth, um, and swelling in the mouth, runny nose, asthma, atopic dermatitis. That's a slower skin reaction, itchy, um, and then gastroenteritis. That's intestinal problems like pain or diarrhea.
Great, great. Yeah, I think that those are some of the very common symptoms which all the parents can look out for in their children if they suspect food allergy. Um, and what are the most common food allergies in children which you have come across in your practice?
Okay. Um, the most common is milk and egg. Peanuts, very common. Tree nuts, a little bit less common. Fish, um, and wheat, soy, shellfish, um, and sesame. That brings up the most common foods to which all people can manifest allergy.
So I think one of the most commonly asked questions and one of the myth around food allergy in children is that can children, develop food allergy after a few years as well, or do they necessarily develop the symptoms at birth itself? Could you answer that for us?
Sure. Um, it's not very common to develop a food allergy as an adult. It is possible. The development of a food or an allergy to food is called sensitization. And I should add, children usually manifest their allergies within the first 3 years of life. Um, the genetic predisposition for manifesting food and other allergies seems to be present from birth through adulthood, but um, most adults don't seem to get sensitized to food allergens. And even if they are sensitized, they don't manifest the level of symptoms that children manifest
Yeah, yeah.
or
Okay.
that children have.
Yeah, yeah, yeah. So it's kind of complicated. I mean, it differs person to person, basically, right? Few kids might develop at birth, and few of them maybe after few years, few of them in adulthood, although it is rare, like you said.
Yeah, well, part of the rationale for that data is that, as I said, in order to manifest a food allergy, you have to be sensitized to it.
Yeah,
And let's say that a child never gets exposed to sesame,
yeah,
um, but the person is exposed as an adult. Yes, that person can then manifest allergy to sesame.
yeah, yeah. This actually brings me to my next question, sir. That so research shows that if like if the foods which call allergy are not introduced to a child at at an earlier age, but at a later age, like let's say in his or her teenage years or in adulthood, they are more probable to develop food allergy, and vice versa. That if the common food allergens are added to a child's diet like early in the development years, like let's say when a child is started on complementary feeding, so then he or her is less probable, the chances of developing food allergy to that particular food are less. Could you like to highlight around this area?
Yeah, I would say um, when you're when let's see, recent observations suggest that early feeding during infancy um, stimulates tolerance to food antigens and subsequently um, food allergy. I guess I should say stimulates intolerance to food antigens and subsequently food allergy, because the child's gastrointestinal tract is not the same as adults. It's more fragile. It allows the proteins that elicit food allergy to get through and then sensitize the systemic circulation with IgE to those food antigens. So even let's say you have a family predisposition to food allergy, but you're never fed that food as a child, and you're exposed to it as an adult, you could develop food allergy, but will tend not to be as severe and not as frequent as children when um, when exposed to the same foods.
Yeah, yeah. So it's always better to, expose all the kids to all these food allergens earlier in their development years, right?
Well, that's controversial.
Yeah,
Um, the data suggested for a while that if you don't expose children to allergic foods early, that they won't develop allergy. But that's not been verified in careful studies.
yeah, yeah, yeah. Great. So basically, whenever the parents, introduce any new food which is uncommon allergen to their kids, should be medically supervised or something, and you should take all the precautions when you introduce it to the child for the first time.
Well, medical supervision isn't the answer to the whole problem.
Yeah.
If you have a very allergic child, I think the parents themselves have to be careful of what they give the children and how much they give to the children and when they introduce it. But there are no guarantees that any of that will save the child from food allergy. For a while, we thought that not feeding peanuts or not exposing child to peanuts, they would never develop peanut allergy. That's not true. And then there were some studies where they gave young children, purposefully peanuts, and they still developed allergy. So there's no absolute answer,
Yeah.
and it's concerning to me as a pediatrician and as an allergist um, that we still don't know all the magic with regard to preventing food allergy.
Yeah. Totally. I guess there's more research needed in this area. We can hope for some good research in the coming years around
Yes,
in children.
there's definitely a need for good systemic research. And there are a couple of groups that are trying to do it, but it seems to be very hard research to do. You wouldn't think it would be so hard because food allergy is such a common problem, and it's can be such an obvious problem.
Yeah.
But the research studies have not been in agreement with each other for the past 30 years.
Okay. Okay. So can you tell us all how to differentiate between food intolerance and food allergy so that the parents can be aware of the symptoms?
Good question. Um, I mentioned that food allergy is pretty carefully defined as having immunoglobulin E against the food. So you can actually do blood tests for immunoglobulin E against specific foods. They're called rash tests. You can do skin tests against foods, and if there's IgE in the skin, it will react, and you'll get a redness and a swelling for that skin test. Neither of these are perfect, but they're pretty good. Perhaps one of the most definitive ways, although it's not perfect either, is what we call oral food challenge. If you think that a child is allergic to a specific food, this you have to do under medical supervision, because God forbid you have anaphylaxis. But and there's some groups in the United States that do this very well and do a lot of these oral food challenges. So in a medically controlled setting, you actually feed the child some of the food and increase it to a certain amount, certain level. And then if the child reacts with any of the symptoms that I mentioned a few minutes ago, that tells you that the child is allergic to the food. Now, intolerance is not mediated by IgE. It's mediated by IgG, sometimes IgM, sometimes IgA, or even cell-mediated immunity. And its symptoms are slightly different. And they're usually gastrointestinal symptoms. And these symptoms include vomiting, diarrhea, abdominal pain, and the like.
Is
So
diaper rash
that's food intolerance.
so is diaper rash a sign of food allergy as well?
No, it's not diaper rash is not usually caused by food allergy.
Okay, okay. So that's
It's a,
nothing to be worried about if your child gets a diaper rash.
I'm sorry, say that again.
If your child gets a diaper rash, that's nothing, it shouldn't be alarming for the parents, right?
That's right. It's more skin sensitivity than food allergy. Now, if the diaper rash is hives or urticarial, that could be food allergy, but it usually doesn't limit itself to the diaper area. It actually is most often seen on the face and the arms rather than the diaper area.
Yeah. So even for the kids who are allergic to food and then they get a diaper rash, that shouldn't be alarming, as long as
No,
it's not spread to the other area, other parts of our body like face and upper body.
that's right.
Yeah. Um, Also, sir, can a child outgrow food allergy?
Yes, depending on the level or the severity of the food allergy, which is really the severity of IgE sensitization, and also depending on the amount of oral um, oral tolerance that we mentioned before. Um, the manifestation of allergy to foods can be outgrown.
Okay, great. So coming to my last question, what are your tips for all the parents having kids with food allergies?
The most important one is that the parent and the child must learn about how and when to use epinephrine. If the food allergy is severe and causes major symptoms and perhaps even anaphylaxis, the use of epinephrine can be life-saving. So the child, depending on the age, or the parents should have what we call an EpiPen available to treat the acute allergy in a child. That would probably be the most important thing. It's also important to learn how to be careful outside of the home so as to um, avoid being exposed to the allergens that the child is allergic to. And this is harder to do than we might think. And sometimes if you cook the food to which a child is allergic in one pot, or if it's stored in a pot and then you put something else in it without washing the pot, there might be enough food allergen in that pot to cause symptoms in the child. And the parents and later on the child has to learn to ask questions and to alert, if they go out to eat someplace, to alert the people who are cooking the food where they visit about their allergens. And this is especially important if the child has the most severe manifestations of allergy, such as anaphylaxis or respiratory tract difficulty, such as asthma and those kinds of things. Those would be the major points for parents.
So is there anything else which you would like to add? I mean, if you feel there's something important about food allergy in children, which, I mean, there must be surely so many frequently asked questions around this area, which you must be, receiving from your patients and your colleagues.
Well, I guess I would say that one of the things that's important if a child has significant food allergies is to find a good physician, a good allergist that can help the child and the parent through the episodes of food allergy, that can help diagnose the food allergy and can help give advice about how to avoid or treat the food allergies. A good physician can be very important.
Yeah, that's a very good point to, always seek help from a professional and seek a physician who is specialized in allergies for your child. And yeah, so like Dr. Frenkel just told us, there's nothing to be worried about, and your child may outgrow food allergy. And even if not, there are ways to, cope up and handle how, limit the intake of food items which cause food allergy, seeing a physician, the parents being aware about how to use epinephrine and everything else that so you have just told us. So I think that's very helpful for all the general population, even the non-medicals. So you have tried your best to explain it in simple terms. I really appreciate it. And I think all this knowledge will be very helpful for all the people who view this. So yeah.
Good,
Yeah.
good. Have a good day, good week, good month.
Thank you so much again.
You're welcome.
Okay, bye.
Bye-bye.